Okay, so I'm Amanda Newhouse. I'm clinical social work faculty at WVU Medicine, and my favorite fall leaf is yellow. But I have to say, this year, like I think it's the red has the different color. It almost looks purple this year. Like I've seen a couple that almost look purple, and I'm like, ooh, that's different. So I really like that. So yeah, I am going to share my screen. Sure. Can you all see this? Yes. Yep. Okay. I got a thumbs up, so that's always good. So today, I'm covering for Anna Butcher, who is our urgent family response coordinator, and she's going to kind of go over, well, I'm going to go over the model of the advocacy services that she provides. Um, I have the honor of working with Anna, and I have to say honor because she has really been amazing and watching some of these services and the impacts that they have made. And so we'll go through kind of some of that. Um, when we first started this program, trying to figure out where Anna's position kind of fits, the mission statement kind of went along to advocate. We really were looking for a way to advocate with patients who are struggling with a substance use disorder within the system, right? Like how do we help them kind of jump through these hoops and help them navigate through? So we like threw around even like an advocacy support person, case manager, like a navigation support person, right? A patient navigator. Um, but really, Anna's mission kind of comes along with providing support to these individuals in a compassionate, consistent, and collective way. She really works with a lot of different agencies to make sure that we're not duplicating or overlapping services. And that we have all the services that we need in place. And so it really is an individualized approach to help individuals who are in recovery become more successful. One of our goals when we were looking at this program and position was it derived from Laura's vision of expanding our community engagement. And one of the areas that the task force kind of identified was increasing communication with other agencies. So making sure that we were providing support to these individuals by really opening up that communication. I think we all get so busy, it can be so overwhelming to stop and collaborate with one another, but how important it is when you have individuals that sometimes don't know what services they're getting or they weren't sure who they talk to. So making sure that we're increasing that communication and even finding out how we can do that better. Right? Sometimes we're all doing the same things, asking some of the same questions. How can we share that information amongst one another that would benefit the patients in a manner that they approve of, that they want us to advocate for them with? So the Urgent Family Response Coordinator role began in May of 2022, again, coming from that strategic plan initiative. And it was a foundation funded position. So we explored where it best fits. And after exploring in July of 2023, we transitioned it to a full-time position. And while it falls under case management, because that's the best that it could align under within our little, it's like that square peg in a round hole, right? Like as that's the best that it aligned into. But the role still focuses on advocacy and setting up resources for patients while building connections with all of those agencies, especially CPS. So one of the discussions that we had was, CPS is very busy and high caseloads. And so we want to be able to provide reports and updates and be involved with that. And so that's a big piece that Anna had come across. So what her workflow kind of looks like and the whole referral process is that she refers, so right now she's seeing, and we're exploring this now, but right now she's seeing patients only within our department. So her referrals are coming through Epic with a patient attached. She introduces the patient, obtains a release, and then schedules an intake. She has tracked and has done an amazing job tracking all of the patients, the caseload, entering their data so that we can have some measures as well. She does an initial intake and gathers tons of information to identify the resources that we need to start looking into obtaining, linking them to, and kind of updates that all within our measures. And then part of her role is really helping patients to prepare and participate in their MDT and court hearings. And we know that best practice is being transparent within those MDTs and parents' participation in the MDTs. And a lot of the times parents weren't always participating in MDTs. Sometimes there were confusion on the dates, on if they attend, on what their goals are. And so this has really helped align that and collaborate, build that collaboration between the MDTs, the court appearances, following up with treatment processes. So this has been very beneficial. And then she also involves any other agencies that they may need. Anna does a great job of pulling up reports, pulling all letters of advocacy together from all of the providers and presenting that in hearings and in MDTs to update and identify what patients have completed, worked towards, what their goals are. And then as she continues, and even during reunification, so what we've identified too was that upon reunification that there's still resources that are needed, right? And so she's been staying in for 30 days after reunification and extending it if necessary, but 30 days after so that she can help link to other resources even after reunification, because a lot of the times that's a huge transition as well. And so when families are placed back together, there's a lot of needs that we have to look at putting in place. And so Anna helps kind of link some of those that they aren't really thinking about ahead of time because they have other resources that they have to link to. So for referrals, Anna has talked about how when we talk about like remaining in good standing with their BMed program, they have to be consistent, right? They have to be in treatment. And many of the times, if providers feel like this is somebody that really could use some advocacy, we'll make exceptions and kind of help motivate them towards that consistency within treatment. They have to maintain contact with the coordinator, attend intakes, complete their release information so that we can extend that and collaborate with others. A big part of what Anna's role is that community advocacy. So the big piece is really preparing for and meeting in MDTs. We find a lot of patients get very anxious about MDTs, right? And school meetings. Anna's gone to school meetings. Sometimes meetings like that can be really overwhelming for parents. Sometimes as a provider, they can be really overwhelming. There's so many people at the table, so many names to remember, right? And roles to identify. People are coming from different lenses. So there's different opinions that are being brought to the table. And sometimes that can be so anxiety provoking for some of our patients who are early in recovery, dealing with a flood of emotions and managing to cope with decision making, difficult situations, right? And so a lot of the times they can go back to some old behaviors, become anxious, and sometimes act out, right? And so we see sometimes patients that aren't sure how to handle all of that stress, and sometimes they respond in an inappropriate way and then get placed in a difficult position. So Anna really helps build them to prepare for that, because it is very stressful and it is very anxiety provoking. And Anna wants them to understand that they're not there alone, and that everyone there at the table wants the best results, right? How we go about it is what's really important. And so she kind of brings that all together for our patients and identifies how important that is. She educates the community on her role and what she does. We've done a lot of education over the past couple of years on Anna's role. And one of the areas of progression that we've been recently talking about is how we expand her role, because she's been asked not only to serve the population, within our department, but outside of our department, and within the community. And it would be great if we were able to do that. We don't have the capacity to do that now, but hopefully with some of her measures, we can identify ways to do that. So part of our goal is just that. And looking at everyone's unique needs, everyone doesn't always need the same thing. They're not all required to do the same thing. Sometimes they get confused on what they need to do. We've had patients, and this is where her role is really great at connecting care and identifying exactly what's needed. I think of one of my patients I had, and from her MDT, she was identified that she needs to engage in parenting courses and domestic violence courses. And she needed to obtain a full-time job and find new housing, right? She was living in a shelter, so she needed to find new housing. She needed to maintain her medicated assisted treatment. She needed to maintain therapy. So she had all of these goals, and to her primary goal was to get that house so that she could get her kids back, get that housing done. So she took on a couple full-time jobs, which she was amazing at, but placing some of the other pieces on back burner. And one of those other pieces were treatment, right? And she was very engaged in treatment, but it kind of started falling to the side. And so she slowly was missing one session, two sessions. And so I was like, hey, let's revisit this. What's going on? Let's stay consistent. And she's like, well, I have to get housing, right? And I have to work to get housing. I did get an apartment, but it wasn't in the right area. They'd like me to get it somewhere else. So I need this other apartment. This other apartment's expensive. So I have to work. I mean, she had down to the T, how many hours she needed to work at each job in order to obtain this within that time frame of her next hearing, right? And so she was very well focused on that treatment goal, and that treatment plan from the MDT, but she was missing that part of treatment, right? And so she prioritized what she thought, CPS was prioritizing, but that wasn't necessarily the case. And so Anna was able to help her identify that. And we helped through treatment too, how important treatment is, and to place that at the top, and how can we fit that in. And I know you all have heard me in every presentation I talk about on here, but I'm telling you, the amount of work that these patients do are amazing, right? The amount of work that these patients put into getting their kids back and obtaining these goals, I am just always astounded by. And even seeing, co-parenting happening. Many of the times Anna will help two parents, out as they're moving towards obtaining some of the same goals. It doesn't always go in that direction, and that can be a little tricky, but it's nice to see them both working, but different needs. And so even, two individuals within the same family system, they have very different needs within their recovery pathway to obtain these kids back. And some have been successful and some have not, right? We'll see some of that. So advocacy is huge. Anna began tracking this pretty much as soon as she started, right? So in June of 2022, she started tracking the advocacy and looking at the different collaborations outside. And you can see throughout the years how that's increased. A lot of the numbers you'll see. So in 2023 is where the climb started. And I think because as we started getting Anna out there and individuals aware of her role and what she's doing, that the collaboration continued to increase. And we'll see all of the numbers increase in 2023. And then what we'll see probably in 2024, so you see it kind of like at a standstill some months and then even lower in 2024. Well, we see it high at the beginning of the year, but now we're like since July, we've just kind of started seeing it lower, and we anticipate that in 2025 it'll probably stay pretty much even with 2024 because we've hit the capacity of patients that we can see. So we're not going to see our numbers change very much because, well, maybe with advocacy because we might get more patients with higher needs of advocacy. But a lot of the measures that we're looking at, we're going to see kind of hit the roof because we're at a standstill with how many patients we can take, and she has a wait list. So it's looking at how we can expand. So if you're looking at attending MDTs or other meetings, she attended 18 in 2022, 2023, 59, right? So we see that huge increase. Collaboration with providers. She started a crisis intervention, and we saw that kind of pick up towards 2023 and 2024. I think patients started utilizing it more because they started identifying the need more. But before, I think it was just not understanding or knowing that that was available to them. Tracking the different outcomes, follow-ups, progress reports, and update reports for the courts. So she went from 45 in 2023 to 59. So we see an increase with that as well. Now, MDT attendance, we see that increase in 2023. So again, just kind of getting out there. I think the big piece was getting out there, really educating the lawyers. Anna did an amazing job really stepping in, introducing herself, getting involved, providing reports that were beneficial. And so really just getting out there. I recently went to a conference where some individuals were like, I don't think we use your service. And I was like, you totally use our service, right? Anna Butcher does some reports, and they're like, oh my gosh, yeah, I've gotten her reports. And so that was good to hear too. So she's definitely getting out there, but sometimes we're just not linking their services. There's so many services. A lot of the times I'll hear in West Virginia, like, we don't have enough resources, we don't have enough services, but I think it's really about us connecting those services and kind of identifying and triaging what's best. And I think Anna's kind of nice at filling some of that gap to identify what they need next. Her progress reports have been really beneficial. And so these reports have really helped the court systems understand the journey that our patients are going through within their recovery. And so not just the treatment they're getting, but the journey. So she's putting together the progress reports of what they've worked on in treatment and how they've attended and their engagement levels, what that kind of looks like. And also jumping in to help clarify or correct any type of misinformation, miscommunication. So this is like low-hanging fruit that can make such a huge outcome. And so Anna's actually been great at just jumping in and working through some of that. She really has pulled together the teams, provided some coordinated reports from all providers. So she does that pretty efficiently. This is our crisis calls that she implemented in 2023. And so you can see where they were lower and then they kind of took off in 2024. But again, with that trend that it's just kind of stopping there, right? Because we're at our roof with our number of patients that we can take on at this time. But patients have really verbalized how useful the crisis calls have been. Anna tries to get back to them within 24 hours. If she misses a call, but she does try to attend to them often. And a lot of the times this can alleviate some of patients' impulses to take it to the next level, right? And so we talk about that stress and anxiety as they're moving forward towards their MDTs or their court appearances. And so Anna just kind of jumps in and alleviates some of that and gives them the time and space to process what's going on. And we see that a lot. We see a lot of appreciation from patients. We've utilized patient statements for a couple different pieces throughout the years. And the three that I got to participate on loved the crisis calls and the ability to call Anna for whatever they needed, right, in those moments. And they weren't using it inappropriately, right? So you could totally see crisis calls being used inappropriately. And in the patients, I mean, Anna's had to set boundaries with a couple, but other than that, like for the most, patients have really utilized the crisis calls appropriately. I think one of the biggest successes that we see is definitely the reunifications that we've identified since Anna started in 2022. And so we've gone from two reunifications to now 18. And so this slide, she's even updated those numbers from 15 to 18, right? So, you know, the reunifications are just amazing. And it's great to, like, who doesn't love, right, like a happy ending? We come across so many endings that are not happy that like you just love those happy endings. So Anna is really great at sharing these reunification stories with providers who've worked so hard to collaborate, all come together and make sure that the best outcomes were provided. And so she really pulls that together in reunifications. We were just talking the other day. I mean, we're going to have to look into this, but we were just talking about searching for some sort of funding for celebrations during the reunifications. Like we need, because that's a huge part of recovery, right? Is moving towards celebrating in a healthy way and teaching families how to celebrate in a healthy way. And what a better time to do it than during reunification after they've tried their hardest to get those kids back. So we're like, yes, we're totally going to look into that. And then aftercare services. So I said 30 days, but she'll stay up to 3 months after. But most have really only done the 30 days, unless there are higher need of services that we need within those 3 months, right? And that's really typical. And we've talked before about the changes in behaviors, and I've uh, spoken to the process of recovery and how kids can act out a lot of the times upon reunification or after that honeymoon phase, right? So after like a week or two back in the home, a lot of the times we see kids act out. And so Anna has kind of stepped into that area and where they need to collaborate and get services for their kids and to help that to be successful because, and it's natural. It's a complete natural process of family systems, right? If you think about the change within a family system, and especially if you have younger kids. So the part that I speak to a lot is that, we have younger kids that memorize. Kids under 7 don't have a cognitive capacity to really remember what's happened or people's interactions, but they memorize who's there for them and in what capacity, right? And so when a parent is in active addiction, their capacity is memorized, good, bad, ugly, whatever it is, it's memorized. And then in recovery, and they come back and that interaction is completely different. It's very scary to a kid. That's all they've known is that other pattern of interaction. And so a lot of the times we get externalized and internalized behaviors. So externalized behaviors of like acting out, kicking, biting, screaming, right? Internalizing behaviors of withdrawing, isolating, crying. So we see that a lot within that process, and it's pretty typical. And that's why family therapy is a huge recommendation in the recovery process as well. So the aftercare services definitely give support along the way and reduces that stress for patients and parents, right? That stabilizing support during that transitional period. It's stressful. Being a parent in general is stressful, right? So imagine dealing with all of these pieces. I mean, the attorney general just put out that surgeon general's warning in August of parenting stress and how stressful parenting is, right? The same label that comes out on cigarettes is now for parenting. Can you imagine that? But, imagine having all of these balls you have to juggle too on top of that. And so it's huge stress nowadays. So ultimately, Anna's role really does advocate for, provides that support, collaborates, and coordinates between all of those. So alone, we can do so little. Together, we can do so much. So true. True. So in 2024, so what we're moving towards now is one, how do we expand her role and so that we can continue to provide this treatment across the board. But another piece that Anna has identified, and when I talk about the high stress levels and how people respond, right, that's their interpersonal skills. And so what they've learned, and many of the times we're dealing with patients who come from unhealthy families and patterns of interactions. They haven't really been taught those interpersonal skills or how to communicate effectively to get those needs met. And so Anna identified this as one of the low-hanging fruit, right? Like if we can just, we provide that support to eliminate some of that stress, now we need to provide some of those skills, right? So she's developed a complete curriculum for professional interaction coaching and de-escalation training that we're going to co-pilot this fall, well, later fall, into one of our weekly groups, and to see how effective that can be as they continue to move forward to advocate for themselves, right? So the goal is that they're able to professionally interact with others and advocate for themselves. This is Anna's contact information. So if any of you, a referral, it would go to Anna Butcher. And then there's her email information, if anybody has any questions. But I can answer if anybody has any questions offhand. I'm happy to answer any questions, comments, concerns.
Amanda, one of the things that came to mind that sometimes we don't think about in the reunification process is, that oftentimes parents have spent, a year to 2 years working on this, and then the kids come back, and then it's really hard, and then they have lots of guilt about like, oh my God, this is what I've wanted, and now it's so hard and I'm so exhausted and I don't know if I can do this. And so I love that, one of the things that I think is important that Anna hangs out with them, for that time period, which can actually be a time of high stress, even though it's like a celebration. It's same as having a baby, right? Like, okay, we're all excited we have a baby. It is really stressful to introduce a new member of the household that keeps everybody up most of the night. So even though it's a wonderful thing, it can also be really hard, and to help parents manage those really strong emotions, including that guilt and shame about it.
Yeah, I think that guilt and shame, thank you, Laura. That's a really good point, because that guilt and shame is so underlying. And many of our patients, that have, or working towards reunification, have lost their children because they've been exposed in utero in some sense, right? So they already hold on to this guilt and shame that just kind of pulls over. So they already have this emotion, and it only, like Laura's saying, it only becomes a bigger emotion because then they've worked so hard for this, and then they're getting overwhelmed by some of the behaviors that are naturally occurring. And then having to admit that they're not able to manage it, and the stress and anxiety that comes along with that. And who do you tell that to? And you don't want to lose your kids. And so facing all of those fears, I commend, we've had a couple women that come to group and they're like, I don't know how to handle it. I don't know how to handle the behaviors, right? And so really, really commending them for looking for the help and looking for the support and being able to provide that, because, just because they don't know how doesn't mean they're not good parents. And so, yeah. Or sometimes the opposite in parenting, and kind of giving them everything they want because they do feel so guilty, and then they get even more behaviors. So it can be a tricky like quo pro there interaction. Yeah. Any other questions?
Hey, I was wondering, you mentioned that you've gotten really good feedback from the parents who've participated. I was wondering if you've gotten feedback from the department or attorneys or the courts about how this also probably helps them a great deal.
Yeah, absolutely. So the feedback, I've gotten great feedback from the judges and the courts and most attorneys about how well their reports were received, how much they appreciate her attending MDTs, kind of translating sometimes what's going on, and support that, right? It's kind of like, you know, when you think of these situations, you think of a high stress situation. Sometimes when you're going for like, I can only think of like when you're going for like bad medical advice, you always take somebody with you because you have so much stress that you don't always take everything in. And I feel like that's what happens. And Anna is able to kind of help structure and articulate that. But yeah, we've gotten great feedback from the department and attorneys and judges. Yeah, recently just got a lot of great feedback from judges.
Thanks.
You're
But
welcome.
I think that's a useful point, Deb, about I'm wondering maybe we should do a more kind of comprehensive or structured request for feedback from Child Protective Services. I know Teresa's on here from Child Protective Services. Any experience? I don't know if you've had Anna in any of the cases that you supervise or work with, and if you have any thoughts on how to collect feedback from Child Protective Services on her service and how to improve it.
Can you hear me?
Yeah.
Yeah.
Okay, great. Yeah, I do work with Anna on at least one or two cases, and my background is substance use. So like 13 years working in Medicaid assisted treatment. So one of the things I realized was truly missing during that period was we weren't working with the department. So as I transitioned to a different job, I decided that we were going to be working with substance use programs because it's so essential. So I love that Anna is working on this side with Chestnut Ridge, and I just hope that we continue to grow like this type of advocacy with other programs. But yeah, I think it's very helpful, and I know that my coworkers they really appreciate Anna and speak highly of her, and we do include her on our MDTs. And it works very nice with our court reports and submitting all of that.
Yeah.
So
That is
yes.
really, really great to hear, both like your background in substance use disorder treatment and that she's doing a good job. That's not been her experience in every county.
Yeah.
So early on, she did experience in some counties, they were like, we don't really want you here. But I think if people can see her as someone who can actually provide the department like consolidated information that will make actually the workload of a CPS worker lighter, that's really our goal. And hopefully it sounds like you're saying.
And working with people who struggle with substance use, the one thing they're very, very good at is playing everybody against everybody. And I've always said, we really all need to be at the table so that we're all talking, because really we're here to help them. And so the more people there to support them, absolutely. But yeah, we need to be talking because they will generally tell us what we want to hear. And so I'm a firm believer in, can I talk to your counselor, or can I talk to your program? Will you allow me to do that? Because it will only help you guys. But yeah.
And you can see that in her MDT numbers initially, right? Like, because she did have, I mean, across the board, she had a hard time getting into MDTs. And even some of the counties that she struggled with getting into those MDTs, a lot of them are starting to open up a lot more and accepting her once they see kind of the benefit of having her involved. But
that's good. I worked in Harrison County for all those 13 years, and there was not a great relationship between the department and the treatment programs. So I am happy to say that now that I'm in Mon County, and I think I've got most of our office on board with the concept that we all have to work together. So
yeah, and that's part of the reason why we love doing these echoes, right? Because a lot of the time we struggle with things we don't know, and we found that providing education over and over and over again sometimes can be really helpful into entering those systems. Great feedback.